Okay, so the surgeries that are recommended by WPATH's new standard of care for transgender and gender diverse people are the ones that we're familiar with: a mastectomy, which is the removal of healthy breasts, a hysterectomy, which is the removal of a healthy uterus, a vaginoplasty, and a phalloplasty. That is the creation of a neovagina or a neophallus, which is a fake penis that they basically staple on the outside of an otherwise healthy young girl. So those we're familiar with. We've heard about these surgeries. We've heard about the enormous rates of complications that come with these surgeries, just really horrific stuff, lifelong health issues, because you really can't mutilate your body like that and expect it just to work, just to take, just to be. And it doesn't work. That's not how our bodies were created. But other surgeries that are recommended by WPATH are voice surgery to make your voice either more masculine or your voice more feminine, an augmentation of your jaw, of your face, to make your face look more masculine if you're a boy. If you're a girl and you want to appear as a boy, WPATH recommends that you get implants in your calves to make your legs look more masculine. Liposuction is recommended to contour your body into the shape that you want it. And then, of course, there's the other cosmetic procedures that WPATH recommends as part of transing care. That would be a brow lift, a hair transplant, lip shortening, all of these surgeries. And as I'm reading through this list on this version 8 of WPATH standard of care recommendations, I think to myself, how much money is the medical field going to make off of the mental health issues of these people who are suffering from gender disorders? How much do each of these surgeries cost? How much profit do hospitals and doctors and big pharma make off of each and every one of these procedures that is somehow medically recommended, insinuating that it's medically necessary for the treatment of gender dysphoria? Imagine telling someone that a jaw augmentation is a necessary part of your health care because you have a mental health problem. In another world, we as a society acknowledge that people who had too much cosmetic surgery, they butchered their face until they were unrecognizable. They had too big of breast implants. They had butt implants that were unrealistic. They removed their ribs so that they could have a tighter waist. There's always stories of young women who have so much plastic surgery to try to look like a Barbie or to try to look like Kim Kardashian. We acknowledge that this is a mental health problem, that they would try to mutilate their bodies to the point that they look fake. They look like someone they're not. How do you marry that having plastic surgery to mutilate your body for those reasons is a problem, and then at the same time, we have recommendations from WPATH embraced by all these these governing organizations of different aspects of medicine that say that no, you need all this kind of plastic surgery to look like someone that you're not, as long as you identify as gender diverse. This is what's so bananas. A couple of hours after WPATH released these recommendations, they issued 3 pages of corrections. Just a couple of hours after. You have to wonder who exactly called them up, where all the angry emails came from. But there are 3 pages of recommendations. I want to read some of the recommendations so that we can establish the pattern of what all of the corrections are related to. This is what they say. On page S48, the following text was removed. With the aforementioned criteria fulfilled, the following are suggested minimal ages for gender-affirming medical and surgical treatment for adolescents. 14 years and above for hormone treatment, estrogens and androgens, unless there are significant compelling reasons to take an individualized approach when considering the factors unique to the adolescent treatment timeframe. 15 years and above for chest masculinization, that's a mastectomy, unless there are significant compelling reasons, etc., etc. 16 years and above for breast augmentation, facial surgery as part of gender-affirming treatment. 17 and above for mediodiplasty, orchidectomy, vaginoplasty, hysterectomy, and frontoorbital remodeling as part of gender-affirming treatment. 18 years or above for phalloplasty unless there are significant compelling reasons to take an individualized approach, etc., etc. Each of those corrections has something in common. What is it? They removed the minimum age requirement that WPATH recommended doctors adhere to. So that's page 1. Go to page 2. On page 2, it says, on page S65, the following text was removed. 14 years and above for hormone treatment, 15 years and above for chest masculinization, 16 years and above for breast augmentation, 17 and above for vaginoplasty, hysterectomy, 18 years and above for phalloplasty. Again, removing the minimum ages. Go to page 3. On page S258, the following text was removed. The following are suggested minimal ages when considering the factors unique to the adolescent treatment timeframe for gender-affirming medical and surgical treatment for adolescents who fulfill all of the other criteria listed above. Hormonal treatment, 14 years. Chest masculinization, 15 years. Breast augmentation, facial surgery, 16 years. Vaginoplasty, hysterectomy, 17 years. Phalloplasty, 18 years. So within hours of releasing this new version 8 standard of care document, they issued this correction, the 3-page correction. The majority of the corrections were related to removing minimum age standards, which means someone, some organization, some group, some lobby hit WPATH hard and said, we do not want age minimums for these procedures and treatments. We do not want to be told that we can't remove the healthy breasts of a 12-year-old when you've said that we should wait until that young woman is 16. We do not want to tell a young man that he has to wait until he's 18 in order to be chemically castrated. We want to be able to do that when he's 13. They removed all of the minimum age requirements, which means all the stories that we've heard, that Libs of TikTok, for example, reported on Boston Children's, how they were or are performing quote-unquote gender-affirming hysterectomies on girls under the age of 18, as young as 15, 16 years old, that these quote-unquote gender clinics at these hospitals will have no reason not to do this now. Because the official standards of care as set forth by WPATH, embraced by these governing organizations in the medical community, have removed the minimum age limits for these different medical procedures.